Hi, Amy. How are you doing? I thought you were sleeping in today.
I'm doing great, Katie. Trust me. I can't miss this moment for anything. I've given up on my old habits of living a sedentary lifestyle where I just sit all day running the family's business. To make matters worse, I didn't even have time to cook a proper meal. So I ate many unhealthy foods. But now, I want to focus on my health and give my body the care it deserves.
You made a wise choice listening to my advice and adopting a healthier lifestyle, Amy. Otherwise, you could have been at risk of developing type 2 diabetes.
Really? How?
Your lack of physical activity and unhealthy eating habits were likely to increase your risk of developing type 2 diabetes. Being inactive and consuming a diet high in unhealthy foods can cause weight gain and insulin resistance, both of which are diabetes risk factors. Insulin resistance means your body's cells don't respond properly to insulin, leading to high blood sugar levels.
Wow, having diabetes sounds serious.
Yes, diabetes is serious as it can harm the pancreas, which produces insulin and increases the risk of other chronic conditions like kidney damage and heart disease. However, there are warning signs such as pre-diabetic symptoms that appear before diabetes develops. Recognizing these symptoms allows for preventive measures to be taken to avoid type 2 diabetes.
Interesting. You seem to know a lot about diabetes, Katie. So, what are the symptoms of pre-diabetes?
Certainly, Amy. Today, I'll reveal 7 pre-diabetic signs you must know before it's too late. From unexpected weight loss to changes in skin color, I'll explain how to recognize these symptoms early and prevent diabetes.
I'm thrilled to learn something new.
And there's more! I'll also be breaking down the process of how these symptoms affect your overall health. Remember, knowledge is power, so listen attentively until the end to learn more.
I'm eager to learn the symptoms so I can avoid them. Let's begin, Katie.
First, if you notice that your wounds are taking too much time to heal, then it's a strong sign that you're suffering from pre-diabetes.
True. I experienced this before changing my lifestyle. But what causes it?
In the pre-diabetic stage, your body becomes resistant to insulin, a hormone that regulates blood sugar levels. This resistance leads to elevated blood sugar levels, which can result in various complications, including delayed wound healing. When blood sugar isn't properly regulated, it damages blood vessels. This damage reduces the number of white blood cells reaching the wound site and lowers collagen production, which is a protein essential for wound healing.
Wow, that's bad.
But there's more. Poor circulation, also known as peripheral artery disease, or PAD, is where the arteries supplying blood to your legs and feet become narrowed and blocked, making it harder for blood to reach your lower extremities. This reduced blood circulation makes it harder for white blood cells and nutrients to reach the wound site, and the healing process is slowed down. In severe cases, PAD can even lead to skin infections and amputations.
OMG! I can't imagine my limbs being amputated because I failed to take care of my health. I must keep working harder to stay fit and healthy.
Great! Another often mistaken sign of prediabetes is frequent urination and increased thirst. This is because symptoms like increased urination are often associated with kidney disease and urinary tract infections. This can make it difficult to determine the underlying cause of these symptoms.
Then, how do we know if frequent urination is a symptom of prediabetes?
The most reliable method is to visit a hospital for a blood test. Then, you can confirm if frequent urination is linked with other clear signs of diabetes like excessive hunger or weight loss.
Okay, but what do you suspect is causing these troubling symptoms?
Elevated blood glucose levels prompt the kidneys to flush out excess sugar through urine, resulting in frequent urination. This urgency can even disrupt sleep. The kidneys pulling water from tissues to expel glucose causes dehydration, leading to heightened thirst and a dry mouth.
That's concerning, since dehydration alone can be fatal.
If not well managed, yes, it can.
What about unexplained weight loss? I heard diabetes can make even fat people lose weight.
Absolutely. But these days, unexplained weight loss is a common symptom of many different medical conditions, making it difficult to determine the exact cause. In the case of prediabetes, weight loss may be one of the first signs of the condition and can be identified by blood tests or by the presence of other prediabetes symptoms, like frequent urination and slow healing of wounds.
So, what causes the unexplained weight loss in pre-diabetic patients?
When your body can't utilize glucose for energy, it resorts to alternative sources like fat and muscle, known as gluconeogenesis. In early diabetes, weight loss might be gradual and overlooked. Yet, when it becomes notable, it signals the condition's advancement. Medical experts define significant weight loss as 10 pounds or 5% of total body weight loss rapidly.
Yikes! Those are tough symptoms to endure.
If you think that's harsh, then wait until you hear the next symptom.
What is it?
Blurred vision is a prevalent symptom of prediabetes caused by fluid buildup in the eyelids due to high blood sugar. This swelling can alter eye shape, causing light to scatter and vision to blur. For some, it fluctuates with blood sugar levels. For others, it persists until blood sugar is managed.
Katie, can blurry vision in prediabetes lead to permanent blindness?
Yes, it can. It's just one of several eye issues linked to the condition. Untreated prediabetes can escalate to diabetic retinopathy, which is a condition that damages retinal blood vessels and causes irreversible vision loss. Regular eye checkups and blood sugar control are essential to stop disease progression, and early intervention maximizes vision preservation.
Now it makes sense. Prevention is better than cure.
Exactly. The next symptom is tingling or numbing in the hands or feet.
Geez, that sounds like a stroke.
While stroke and numbness or tingling in the hands and feet are often related, they're different issues.
Oh, I see. But what exactly causes tingling or numbness in the hands or feet of prediabetic patients?
Well, numbness or tingling in the extremities, known as peripheral neuropathy, occurs due to nerve damage from high blood sugar levels. This sensation can be accompanied by pain, burning, or weakening in the hands or feet. Quick medical attention is important, as untreated neuropathy can worsen, leading to loss of sensation, mobility issues, and even amputation.
Wow, that's really bad. I don't ever want to be in such a situation,
and hopefully you won't.
What about fatigue, Katie? Isn't it also a symptom of prediabetes?
Yes, fatigue is a common sign of prediabetes, caused by various factors. One is insulin resistance, where cells become resistant to insulin, leading to high blood sugar levels, or hyperglycemia. Hyperglycemia reduces energy production in cells, resulting in weakness and tiredness.
Would the fatigue go away if blood sugar is reduced?
Yes. If someone with prediabetes lowers their blood sugar levels, they might experience reduced fatigue. Controlling blood sugar through diet and exercise can enhance overall energy levels for people with prediabetes.
The more I learn about diabetes symptoms, the more I want to prevent it with exercise and healthy eating.
You should. That's the best prevention strategy. Finally, there is skin discoloration.
What exactly is that? Does it make someone's skin appear pinkish or something?
No, not like that. Skin discoloration, or acanthosis nigricans, is common in diabetes and insulin resistance. It causes darker, thicker, and wrinkled skin, usually in the folds like the neck, armpits, and groin. While it's a sign of excess insulin production and skin inflammation, it doesn't necessarily mean diabetes. However, it can be a warning sign and should be checked by a doctor.
I heard that some pregnant women and obese patients also experience the same symptoms. So, does this mean they have diabetes too?
Well, skin discoloration can be a symptom of diabetes, but it's not exclusive to the condition. Obesity and pregnancy can also cause it. If someone has this symptom along with others like excessive thirst, hunger, and fatigue, they likely have prediabetes.
Understood.
Now that you know the 7 pre-diabetic signs, what would you do if you experienced any of these symptoms?
I'd see a doctor immediately. I can't risk losing my eyesight or limbs. Thank you, Katie, for teaching me about my health.
It's my pleasure, Amy. After all, what are friends for?
So true. Anyway, let's not forget why we're here and get back to completing our workout session.